Schizophrenia is a serious mental illness that impacts a person's thinking, emotions, and behavior. People with this condition frequently experience hallucinations, such as hearing voices or seeing things that aren't present, and delusions, which are false beliefs not grounded in reality. Common symptoms also include disorganized thinking and speech, as well as diminished emotional expression. Treatment generally involves a combination of antipsychotic medications, therapy, and support services to help manage symptoms and enhance quality of life. Wonderland syndrome, also known as Alice in Wonderland syndrome, is a rare neurological condition that causes distortions in perception, particularly regarding size and space. Individuals with this syndrome may experience sensations such as seeing objects or body parts as larger or smaller than they are, feeling as if their body is changing size, or perceiving the environment as distorted or surreal. These perceptual disturbances can be unsettling and may accompany migraines, infections, or other neurological conditions. Treatment typically focuses on managing underlying medical issues and addressing any related symptoms. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder marked by ongoing patterns of inattention and hyperactivity that can greatly affect daily functioning. Symptoms typically appear in childhood and may continue into adulthood. Inattention symptoms include difficulty maintaining focus, organizing tasks, and completing instructions, while hyperactivity impulsivity symptoms include fidgeting, excessive talking, and trouble waiting for turns. Treatment often includes a combination of behavioral therapy, medication, and support strategies to help individuals manage symptoms and improve their functioning. Jerusalem syndrome is a rare psychological phenomenon in which individuals visiting Jerusalem experience intense religious delusions or psychotic episodes. This condition is often triggered by the city's religious significance and may involve beliefs of being a biblical figure or receiving a divine mission. While most visitors to Jerusalem do not experience this syndrome, those who do may require psychiatric intervention or hospitalization to ensure their safety and well-being. Obsessive-compulsive disorder is a mental health condition characterized by intrusive, unwanted thoughts known as obsessions and repetitive behaviors or mental acts called compulsions. Common obsessions include fears of contamination, doubts, or intrusive thoughts about harm, while compulsions often involve rituals such as hand-washing, checking, or counting. OCD can significantly interfere with daily functioning and quality of life. Treatment typically involves cognitive behavioral therapy, CBT, medication, or a combination of both to help individuals manage symptoms and improve coping skills. Bipolar disorder is a mood disorder marked by alternating periods of depression and either mania or hypomania. During depressive episodes, individuals may endure persistent sadness, loss of interest or pleasure, changes in appetite or sleep, and feelings of worthlessness or guilt. Manic or hypomanic episodes involve elevated mood, increased energy, racing thoughts, and impulsive behavior. Bipolar disorder significantly affects mood, energy levels, and behavior, necessitating continuous treatment with mood stabilizers, therapy, and support services. Social anxiety disorder, also referred to as social phobia, is characterized by an intense fear of social situations and interactions, rooted in a fear of judgment, embarrassment, or humiliation by others. Individuals affected by social anxiety may avoid gatherings, public speaking, or situations that trigger anxiety, which can greatly distress and impair daily life. Treatment usually includes therapy, medication, or a combination thereof, aimed at helping individuals manage symptoms and enhance social functioning. Agoraphobia is an anxiety disorder marked by a strong fear of situations or places where escape could be challenging or humiliating, which leads to avoidance behaviors. Those with agoraphobia may fear crowded areas, using public transport, or being alone outside their home. This fear can heavily affect daily life and may result in isolation or reliance on others. Treatment usually includes therapy, medication, or both to assist individuals in confronting and managing their fears. Hypersexual disorder, also known as compulsive sexual behavior, encompasses intense and repetitive sexual fantasies, urges, or actions that disrupt daily life or cause distress. Those affected may excessively use pornography or engage in risky sexual activities, often leading to feelings of shame, guilt, or relationship difficulties. Treatment typically involves therapy, medication, or support groups aimed at addressing underlying issues and assisting individuals in regaining control over their sexual behaviors. Alien hand syndrome is a rare neurological disorder in which one hand behaves involuntarily, seemingly independent of conscious control. Individuals affected by this condition may observe their hand performing actions or movements contrary to their intentions. This phenomenon can cause distress and disrupt daily life, often necessitating management strategies to help individuals cope with symptoms and maintain functionality. Did you know about all these disorders? Leave your comment below and don't forget to subscribe. Paris syndrome. This is a temporary psychological condition observed among tourists visiting Paris, marked by feelings of disappointment, anxiety, or delusional beliefs about the city. Symptoms can include hallucinations, paranoia, or derealization, often triggered by the contrast between tourists' idealized expectations of Paris and the reality of their experience. While many visitors have a positive experience in Paris, individuals experiencing Paris syndrome may need reassurance, support, or medical intervention to address symptoms and ensure their well-being. Jumping Frenchman of Maine disorder is a rare startle disorder defined by exaggerated and uncontrollable reactions to sudden stimuli or commands. Those affected may display extreme startle responses, such as jumping, shouting, or imitating others' actions involuntarily. While the exact cause of this disorder remains unclear, it is thought to stem from a blend of genetic, environmental, and cultural influences. Wendigo psychosis. This is a cultural phenomenon observed among certain Native American communities, characterized by a belief in transforming into a cannibalistic creature known as a Wendigo. Those affected by Wendigo psychosis may display symptoms such as an intense craving for human flesh, hallucinations, or violent behavior, often exacerbated by fear, famine, or social isolation. While rare, instances of Wendigo psychosis underscore the complex interplay of cultural beliefs, mental health, and environmental stressors within indigenous communities. Piblokto, also recognized as Arctic hysteria, is a culture-bound syndrome observed within indigenous Inuit communities in the Arctic region. This condition manifests as episodes of irrational behavior, typically triggered by extreme cold and isolation. Symptoms may include screaming, uncontrollable laughter, or disrobing in freezing temperatures, followed by periods of amnesia or confusion. Although the exact cause of Piblokto remains unclear, it is thought to be linked to cultural beliefs, social stressors, and environmental factors. Narcissistic personality disorder is a mental health condition marked by a persistent pattern of grandiosity, an ongoing need for admiration, and a lack of empathy towards others. Individuals with NPD typically exhibit an inflated sense of self-importance, exaggerated achievements, and a strong sense of entitlement. While some narcissistic traits are normal, NPD causes substantial impairment in social, occupational, and other aspects of life. Treatment may include therapy aimed at addressing underlying issues and fostering healthier coping mechanisms.